Spalding, Executive Director of Wake County Human Services. Welcome to Real Life, a show about issues impacting your family and your community. We have several exciting topics for today's program. First, Dr. David Damsker and our colleagues in Environmental Services have tips on keeping our pets and ourselves safe from rabies.
Thanks, Maria. Hi, I'm Dr. David Damsker with Wake County Human Services. Today, I'm at the Wake County Animal Care Control and Adoption Facility here in Wake County. Here at the Animal Care Control and Adoption Center, they deal with all kinds of issues like rabies vaccines, stray dogs, and as well as adoption of stray dogs. While I was here, I had a chance to speak with several of the staff and get their insights on what they do on a daily basis, specifically how it deals with rabies vaccine and disease.
One of the biggest concerns about rabies is that at this time we still don't have effective treatment. So once infected with rabies, it is certainly a very grave situation. We have recently had a survivor of rabies infection in the Midwest, but that's very, very unusual. It's very important to vaccinate our pets so that we stay safe.
It's also best that you make sure your dogs and cats are up to date on all its vaccines, including rabies. It's very important because they are the buffer between us and wildlife.
The most important thing you can do for your pet is to keep them up to date on their rabies shots. If you have a dog, cat, or ferret, it is mandatory that every animal 4 months or older be up to date on their rabies shots. The big reason for this is if your dog or cat is exposed to a rabid animal, they will be protected as well as not bring the virus into your home.
Rabies is a serious virus. It is fatal to both humans and animals, mostly transmitted through what we call rabies vectors, foxes, raccoons, skunks.
Well, rabies virus is an extremely serious virus. It's a viral infection that affects all warm-blooded mammals. So not only does it kind of affect your raccoons and skunks that are more common, it also can attack your dogs, cats, and even humans.
I want to emphasize that the rabies virus is only gotten through the saliva of an infected animal. By petting a dog, by even, like I said, touching feces or urine or blood, the rabies virus is only transmitted in the saliva. So that people need to keep that in mind. While it is a deadly disease, it is not that easy to get. Nationwide, there's approximately 1 to 2 deaths every year from rabies. The most common animal that transmits rabies in 2006 actually are bats. And people pick up bats. People are bitten by bats, may not know it or don't think there's anything to it. And that actually, nationwide, is the most common reason why people are still developing rabies, is because they're not telling doctors or the health department about an exposure they had to a bat.
If you are bitten by an animal, the first thing to do, of course, would be try to wash the wound with soap and water and immediately contact animal control. 212-PETS would be the phone number to call and report the bite. And from there, they will dispatch an officer to either remove the animal for testing or to be held for quarantine for a 10-day period.
It's very important to remember that if a dog or cat bites you, whether it's your own dog or a neighbor's dog, that you go to the emergency room because it's very easy to get an infection from the bite. Animals have bacteria in their mouths that are very dangerous if it gets under your skin. So we talk about giving antibiotics to people who are bitten. We also talk about getting a tetanus shot in those who are bitten. And if you can keep the dog for 10 days after you're bitten and they don't show any signs of a rabies virus, then you don't have to worry. The dogs and cats that carry the rabies virus, if they are in fact infected, will start to show signs of disease within 10 days of biting you.
It's primarily transmitted through the saliva, through bite wounds, though it can be through on the hair, the saliva that might be attached to the hair of an animal, especially if two animals have been fighting. It could be that way. So it's very important that when handling wildlife, especially, that you do wear gloves and wash your hands thoroughly afterwards.
It's always good to feed your pets indoors, especially if you live in a wooded area where if you leave a bowl of food in the backyard for your dogs, that may attract things like raccoons, foxes, and other animals that could in fact be diseased and possibly interact with your dog.
Well, your domesticated animals, your dogs and cats, it is best if you could feed them inside, but if you have to feed them outside, it's best that you make sure the animal eats all of its food and then remove any of the food that's left. You also want to make sure your trash containers covered and tightly sealed so it doesn't invite raccoons, skunks, and other wildlife to your outside environment.
One of our biggest challenges in veterinary medicine in managing rabies is the feral cat population or the stray cat population. Many people feed cats on their back step, but they don't really take ownership, and so the cats never get into a veterinarian, are never vaccinated for any diseases, but in particular rabies.
As you can see, rabies is a very serious disease. However, with the prevention techniques we have learned throughout the show today, as well as from good common sense, we can prevent anyone from getting sick with this disease. Back to you, Maria.
Dr. Damsker will join us again later in our program. Now we travel with Deputy Director Bob Sorrells to the Eastern Regional Center in Zebulon as we roll out the red carpet for a new member of our leadership team. Take it away, Bob.
We're here at the Eastern Regional Center in Zebulon, and I am pleased to introduce you to the new director, Daryl Blevins.
Thank you, Bob.
Daryl, tell us how your first month on the job has been.
Bob, has been really good. It's been a smooth transition. I've spent the first month really trying to get to know the staff and the different programs that's being offered here in the center. And I spent quite a bit of time also in the community, meeting my advisory board and trying to get a feel for what the needs are in this community.
Though you've been in this position for only a month, you've actually worked for Wake County Human Services for almost a decade. Would you like to tell us a little bit about some of the other positions you've had?
I started in Wake County Human Services in 1997. I was a clinical supervisor over in the court-mandated programs, and eventually took a position over in the Sunnybrook building as the program manager for the Perinatal Substance Abuse Initiative.
You have had a leadership role in a number of positions with the county, but you're also a leader in your other work that you do outside the county. Tell us about that.
Yeah, Bob, I'm also a member of the North Carolina Air National Guard, 145th Air Wing in Charlotte, North Carolina. I've been in the Guard for about 13 years now. I actually had about 22 years of total service, active duty and Guard. And my position there, I'm the Military Opportunity Officer there, and do a lot of work around unit climate assessments and human relations education.
Well, Daryl, we need to thank you for your service to your country as well as to the citizens of Wake County.
Well, thank you.
Tell us a little bit about your educational training and what brought you to North Carolina.
Well, Bob, I got my undergraduate degree from Black Hills State University when I was on active duty. After I completed that, I went ahead and enrolled in Central Michigan University where I got my graduate degree in Health Services Administration. What brought me to North Carolina is my wife is from North Carolina. I actually fell in love with North Carolina years ago, and we decided to plant our roots here in North Carolina.
Well, we're glad to have you here in North Carolina.
Well, thank you.
And particularly in Wake County.
Thank you.
Give our viewers a brief overview of some of the services they could expect to receive if they came here to the Eastern Regional Center.
Wow, Bob, this center offers an array of services. I was really surprised when I got down here. It's just all the different services they offer. You know, we have the health services, which you can get some basic health services down here, including prenatal care, immunizations, and physicals. We also have child welfare. We have the economic programs where folks can come in and apply for food stamps and any other kind of assistance that we may be offering at the time. We have a job link center, a pretty thorough job link center to help connect people to employment in the community. We also have the privilege of being co-located with some of the other programs within Wake County government, such as inspections in the Sheriff Department. You also can pay taxes in this facility. So we have an array of services that citizens can come in and access.
So this isn't just a human services center, it is a comprehensive county services center.
Absolutely, absolutely.
What is your vision for the Eastern Regional Center, Daryl, and what are some of your goals?
Well, Bob, I tell you, I think the concept of the Eastern Regional Center is a great concept, and I think one of the greatest things about being out here is just to access the services. That's one of the greatest benefits I see is the access to the services here in the regional centers. Also, I want to work with the communities a lot more and finding out what it is that the communities see as the needs that we should be delivering out of this center. And then pulling together our resources and developing partnerships to be able to meet some of those needs. I see the centers as being just an integral part of delivering services throughout Wake County.
Well, Daryl, thank you for taking time to share something about your past experiences and about your vision for the Eastern Regional Center, and we're glad to have you on board here. And now, back to you, Maria.
We look forward to working with Daryl as he embraces his directorship at the Eastern Regional Center. Helping teenagers find the right path in life is the focus of our next report. Co-chairs of the local Gang Prevention Partnership, Gibby Harris and Alan Mariera, lace up their gloves to help teens keep their eyes on the prize.
Thank you, Maria. Alan, we're here in the gym of Second Round. Why don't you tell us a little bit about the program and how it got started?
Second Round got started as a partnership between Kid Gloves, a nonprofit I started about 5 years ago, and Haven House Services for homeless youth. And it was a way for them to draw high-risk kids into something that would be maybe identifiable with them. We use boxing as the draw to draw the kids in. And once the kids are in, we expose them to mentoring, life skills, to positive pro-social behaviors, and also to male bonding and other social type of activities. We have a lot of kids that we target that are gang involved, and when they come through these doors, our motto here is color-free, which means there are no race colors or gang colors allowed in the gym, and they live by that motto. And so the kids kind of police themselves. I think in the 6 months that we've been running Second Round, we've had a lot of success with the kids coming into the program and showing that those behaviors, those positive behaviors outside of the program into the communities and schools.
Help us understand what the goals are for these young men. Do they set their own goals? Do you set goals for them? What are the outcomes that you're looking for with this program?
A lot of these kids that come here are kids that haven't been exposed to a lot of the positive social skills that they need to develop to make decisions, wise decisions and choices, out in their neighborhoods. And so we help them to create goals and achieve goals. A lot of our goals here are towards boxing because that is the draw. We also help them achieve goals that they set for themselves academically. We have one guy in here that used to roll with a gang and is now out of a gang and is looking to go to college. And he's asking us for help in that area. So he's seen that there is positive adults that want to help him out in his choices for his life.
You're showing these young men that there's not necessarily a limit on what they can accomplish if they've got support to make that happen. And it's not necessarily support that they get in the community, but they can come in here and get it.
That's what we focus on a lot, is that they're welcome here, that they have a home here, that there's a family environment here. With young men, especially young men from single-parent families, they're looking for that connection with other male adults, and we provide that for them. It's funny to see young guys come in here who are real tough, and once we tell them that we really want them in this program and things, it starts to break down those barriers, and they become kids again. They lose that toughness and become kids and want our attention.
I've been arrested and things like that. I've been in trouble before. Drugs and things like that can mess with a young kid. And this is a place where none of that affects them, and we keep them safe from that stuff. It gives them a chance to see that they can be a part of something that's positive, and it still makes them feel tough at the same time. They can box, but not take it out on each other. It's a great thing. Especially for these young kids that are influenced by the older gang members in the neighborhood that pretty much run everything, and so they just follow what they do. But they can come here and see somebody that they can look up to mutually, with the same love and admiration for that person, and see what they do in the ring and see how they're a man and stand up for what they believe in. The Second Round is a second chance. It's my first choice. It's what I like. It's what I like to put my energy into, and it'll take anybody who puts enough work into it. It'll take them wherever they want to go.
Well, might have ended up in the wrong way, but I knew coming through this program was going to take me to the right way. I thought when I first came to this program, I fell in love with the sport, and I've been thinking of going pro. To me, it just means that I have friends to look for in this program. I'm a role model to my brother. Boxing to me, it's always been a pleasure. I always used to watch it, and if I hadn't come here, who knows what would have happened with my health and what type of stuff will I be affiliated with.
Matt, tell me a little bit about the other programs that happen in this building and how they tie into the second round program.
Primarily three main components of this program. One is the independent living program, which has outreach services, Project Ready, which is a program that helps kids get jobs and go back to school, and second route program. We feed kids from all those different components into the boxing program.
Are there specific partnerships that you have that help you get all of these services done, particular agencies or groups that you work with?
Mostly a lot of United Way agencies, and we're very involved with the Gang Prevention Partnership, Wake County Gang Prevention Partnership.
And are you personally seeing that some of your goals are being met by having second round as a part of the continuum of services that you provide?
We use second round as what we call the hook, which is the draw for the kids to come in. It's a cool program. The kids really enjoy it. But what we do is we leverage their active participation in other important components, in educational components, getting jobs. And we basically say, for you to participate in this program and learn how to lift weights, how to learn to box and have that opportunity, we expect your participation in school. We expect improvement in your behavior. We expect appropriate behavior in the community. We expect you to do what your parents ask you to do.
Wow. I'm always pleased to see partnerships and creativity come together to solve difficult issues. This month, we have two special opportunities to engage the public in key areas of our work. Substance abuse takes a heavy toll on lives. Giving hope through recovery is one of our goals at the Alcoholic Treatment Center. Martin Woodard, manager, has more on our Voices for Recovery and how the Alcoholic Treatment Center is helping to build a stronger, healthier Wake County.
Hello, I'm Martin Woodard, Director of Acute Services, and I'd like to welcome you to one of Wake County's premier facilities. That would be the Larry B. Ziverink Senior Alcoholism Treatment Center, or as most people refer to it as, the ATC. The ATC has been providing hospital-based treatment services for over the past 29 years. That's on both an outpatient basis as well as inpatient, serving the needs of individuals who are suffering with alcohol, other drugs of addiction, as well as those who are compounded in dealing with the issue of a dual psychological diagnosis. I'm real proud of the men and women here who work at the ATC for all their hard work, their compassion, and the results that they are able to achieve on a daily basis. Let's tour the facility.
Wake County's Alcohol Treatment Center is a 29-year-old facility that has been serving the needs of those who have alcohol and other drug problems. We serve some 600 people per year. It is a 34-bed psychiatric hospital that specializes in the treatment of chemical dependency. We have an 8-bed medical detox, which provides a full array of medical services available to people withdrawing from various chemicals. We have a 26-bed treatment facility who's been named in honor of our first medical director, Dr. John Howard.
I'd like to thank Laverne and Charles for joining us today, for participating in this Recovery Day announcement event for us. And let me get started by asking you a few questions. Maybe first of all, if you could tell us about some obstacles that you may have encountered that prevented you from coming to treatment quicker than you might have done.
One being is, I didn't know that I had a disease. I thought I was just morally bad. You know, that I had done a whole lot of things that kept me from being a productive person in society. You know, and as I continue, as the disease progressed and things got worse being that, you know, spirituality was gone, no hopes, no dreams, you know, isolation, disconnection with the family, you know, the pain. And not only that, the disease took me to places that I thought I'd never go or I didn't want to be.
I guess some would be that, you know, would I be able to stay stopped? You know, was I certain that I would be able to surrender and you know, not abuse alcohol and drugs for the rest of my life? You know, little did I know at that time that it was a one-day-at-a-time program, you know, for the rest of my life. And I didn't have to do it all right then. And, you know, I guess another obstacle would be, what would I do with my life if I was able to stay stopped? You know, would I be able to have a job? Would I be able to have relationships with people? You know, I never had any of those things when I was abusing alcohol and drugs. So I had a lot of questions when I came into here.
Can you say a little something about what you got out of treatment that maybe helped you get your start in recovery?
Well, for me, what it did, it introduced me to the disease of addiction. It brought my awareness, it educated me of what I was dealing with, and it helped me to see that I wasn't morally bad. You know, I just needed a personality change, a change in my attitude, thinking, and behaviors. And it introduced me to some life skills or tools that I could use to help me to put my disease at rest. You know, and more importantly, it helped me to see that the drug was just a symptom. The problem was me. So I had to do a lot of changes, and it introduced me and helped me to start dealing with Laverne.
I knew nothing of treatment. I had been to treatment numerous times, but until I was ready to do it for myself, the recovery program, you know, that was when I started to understand what treatment was. You know, it educated me on what the disease was about, that, you know, it's like she said, you know, the alcohol and drug was just a symptom. You know, I didn't know who I was, you know, that I had problems with myself besides the alcohol and drugs. And treatment gave me tools, the tools I needed to have, that when I left treatment, you know, and went to the outside world, that I would be able to live.
How about recovery? What has recovery given you in your life?
Wow, the biggest gift that recovery has given me is the hope. And it's given me some tools, the 12 steps. The 12 steps of the program that I'm affiliated with helps me to look at me.
Recovery has given me a life today. I have goals today. You know, before I became clean and sober, my only goal was a drink or a drug. That was it. 24 hours a day, 7 days a week. Today, it's not like that.
On September 24th, ATC is hosting Voices of Recovery, a celebration for recovery.
Also in late September, Human Services wants to help children live long, disease-free lives. Dr. David Damsker has more on how we hope our children will become big shots September the 23rd.
Thanks, Maria. Today we're here in Clinic E, second floor of the Sunnybrook building, where many kids get their vaccines on a daily basis. We're also here to talk about Big Shot Saturday and why it's so important that as many children get their vaccinations as possible. Earlier, I spoke with Sarah Hauser, the Wake County Human Services Immunization Supervisor, about this event and why it's so important.
Immunizations are important for several reasons. They prevent a lot of serious illnesses. Immunizations prevent long-term complications of disease as well as death. For the first few visits, they generally get DTaP, which is diphtheria, tetanus, and acellular pertussis. They get polio, they get hepatitis B, they get pneumococcal and Haemophilus influenza type B. The immunization registry is a web-based immunization registry, and all the counties in North Carolina are online with that. and gradually private providers are being brought online so that conceivably in the future someone could go to any physician's office or any health department and their immunization record could be accessible to any clinician. I believe Wake County has such a high immunization rate is because whenever the clinicians or nurses or doctors see the patients that come to them for services, they try to screen the record carefully and give the client all of the necessary or indicated immunizations each visit.
In 2006, immunizations are as safe as ever. There are no substances in any of the vaccines that are required for school entry that would cause anyone any issues when it comes to a child's development.
Well, North Carolina law actually requires that children be up to date on immunizations within 30 days from the date they are enrolled. And then when the 31st day rolls around, they would be suspended. The 30th day from the date of enrollment will be imminent when Big Shot Saturday is held. So this would be an opportunity to come and get those shots done.
Here in Clinic E at the Sunnybrook Building, we offer all kinds of services for Wake County citizens. We offer immunizations for both adult and children. We offer tuberculosis screening, as well as a foreign travel clinic. Big Shot Saturday is a partnership between Wake County Human Services and the Junior League of Raleigh.
The partnership with Junior League came about last year. It was the first year that we did the Big Shot Saturday, and other junior leagues in other areas in North Carolina have also held Big Shot Saturdays. And they are able to network and obtain things that they can bring to the clinic. They bring things to help entertain the kids. They bring healthy snacks. They sometimes have incentives, goodie bags, things to give the kids to make it a more enjoyable experience. Big Shot Saturday is important because it enables parents who may have difficulty, may not be allowed to leave the workplace, to bring their children during normal business hours that we usually see patients, and it gives them an opportunity to come on a Saturday and obtain necessary immunizations for their children. We do try to recommend that whenever a parent brings their child in for services that they always bring all of their immunization records with them so that we can give them accurate and avoid unnecessary duplication of vaccines. Big Shot Saturday we held in Clinic E of the Sunnybrook Building on Saturday, September 23rd. We will register patients beginning at 9 a.m. and we will start registration at 1 p.m. North Carolina is a universal state, which what that means is that any required vaccine for kindergarten entrance is provided free to any child regardless of eligibility.
As you can see, Big Shot Saturday is an event you do not want to miss. Back to you, Maria.
Thank you, David. As you can see, Wake County Human Services impacts so many lives through our programs, partnerships, and services. Well, I think that's a wrap. Thank you for joining us today. I'll see you next time on Real Life.